G'day, Matt Legends. So, can you have too much mobility? I think it's an interesting question. It's one of those questions that comes up a bit from time to time in our courses because I think inherently most of us are always thinking, oh, we always need to give more flexibility. Everyone needs more flexibility all the time, right? Everyone's always feeling tight. They're always feeling stiff. And so therefore more flexibility, more range of motion. It's always the answer. Sometimes not so much. And I had a really good case example from today when I was doing a super session testing session here at the clinic. So I was taking one of my patients through our big assessment profile that we do here, where we get to, I guess, get some real baselines on where people are at. So we were using the mat a lot. We were using a lot of strength testing as part of that to get a real understanding of where this individual was. Now, to give you a little bit of background, so this was a female, mid-40s. She'd had back pain for a period of time, mostly episodic though, up and down. So she'd have an episode of back pain and then, it would recover and then, it would kind of happen again, right? And so this would have been happening on and off. So she came and saw me with an episode of her back pain. She'd usually been seeing someone else. And so we did some treatment. We helped settle her down. Her pain went away really quickly. Fantastic. Now, of course, is then the most important part where I explained to her, look, it's probably going to come back again. You've had this on and off for a long period of time unless we do something about that. So what we did is we put her through our testing profile. Now, the fascinating thing for her was that she kind of thought, oh, look, I'm pretty stiff, I'm pretty restricted. Actually, when we started to assess her on the mat, particularly doing some tests around her hip and lower limb internal rotation, as well as doing some of our spinal assessments, she was actually really quite flexible and probably more in the hypomobile range, the hypermobile range. She had too much flexibility probably than or more flexibility than your average person. Now, potentially this is okay, but for some individuals, they're not going to have the strength and the capacity to control and look after that flexibility. And that was the hypothesis that we went into. So the next thing that we did is we did a bunch of strength testing. So we did some things like some single leg sit stands as we would teach in the course. We did some, rep max testing using some gym equipment, as well as using our revolutionary axis system as well to be able to kind of test out her strength. And now the interesting finding was she was really mobile through her hips, quite a lot of internal rotation. And when we actually tested specifically around her hips, we found some big discrepancies from side to side and probably some deficiencies in terms of what she actually could do for what she should be able to do. So she was quite weakened on her left side, particularly through her left glute area and that posterior chain, as well as then her overall strength was overall reduced. And so the hypothesis then that comes out of this is, okay, well, is some of this back pain or is some of the issues that she's been getting, is that actually not because she doesn't have enough flexibility or she doesn't, she doesn't move well enough, she doesn't have enough mobility, but actually is it a big strength issue? Now, we're going to go ahead and we're going to work on her strength and we're going to help improve that. But unless I had the ability to measure her flexibility, it would have been very hard for me to necessarily make that call and particularly compare her results to the results of most other people that we encounter through there. So the takeaway here, once again, don't always go in with okay, someone's feeling stiff and restricted, I need to give them lots of flexibility exercises. You might find quite a few people who are feeling like that are actually flexible enough and they need to look after their strength. Number two, make sure that you're measuring flexibility and comparing that to some type of baseline as well, because if you're not measuring, then you're guessing, as we always say. And it's very hard for you to have those conversations with someone to be able to talk to them about the fact that they are maybe more in the hypermobile range if you've got nothing to compare it to. Otherwise, it's just your opinion in many ways. And particularly, most people think that they're stiff and that they're restricted, and it's going to be hard to convince them otherwise unless you've got some good measurements to go by there. So looking forward to working with this patient and this client and hopefully getting some great results for them in the near future.